Out over the ocean, we believed there was nothing but clear skies ahead as we said, "I do," and pledged to support each other in sickness and in health. Who could have predicted that the sickness part would start less than 1 month later? We returned home from our honeymoon, and our world immediately turned gray and stormy as my health took a nosedive. I woke up one day, and my hands were weak, tingly, and painful. Then, a few days later, I lost the vision in my right eye. I was rushed to a team of specialists, and within a week the diagnosis of multiple sclerosis was confirmed. Multiple sclerosis is a chronic, progressive disease of the central nervous system, the brain, optic nerves, and spinal cord. It's an autoimmune disease, which means the body's immune system attacks healthy cells in the body. In the case of MS, the immune system attacks the myelin, a protective fatty layer surrounding the nerves. Think of it as insulation that keeps the nerves firing smoothly. These immune system attacks create lesions in the myelin sheath. I imagine little holes being eaten in my nerve linings that leave areas of raw, exposed nerve prone to misfiring. Each person living with MS experiences a different set of often debilitating symptoms, depending on which nerves are affected. There's no cure. All that most doctors can do is offer patients medication, rehabilitation, and coping skills. A promising stem cell treatment is being tested and other research is underway, but for now, MS is a disease that must be managed, not cured. Primary symptoms, those arising directly from damage to the myelin and nerve fibers, include fatigue. Fatigue is one of the most common symptoms of MS, occurring in about 80% of people. Fatigue can significantly interfere with a person's ability to function at home and at work, and may be the most prominent symptom in a person who otherwise has minimal activity limitations. Other primary symptoms can include numbness, problems with mobility, balance, and coordination, bladder and bowel dysfunction, vision loss, dizziness, vertigo, sexual dysfunction, pain, cognitive difficulty, depression, muscle spasticity, tremors, speech disorders like slurred speech and difficulty finding words when speaking, swallowing problems, headaches, hearing loss and seizures, and respiration and breathing problems. A frighteningly daunting list, but different people exhibit different symptoms. There are secondary symptoms, too, complications from these primary symptoms. For example, anyone whose bladder function is affected may suffer from frequent urinary tract infections, or if someone has a lot of trouble moving and walking, the inactivity can result in loss of muscle tone, muscle weakness, decreased bone density, and risk of fracture. Neither Mark nor I signed up for this. We both feel cheated out of the life we planned together, the house we planned to buy, the children we wanted to have. Those feel like absurd dreams now, since all we can do is hold on to each other for dear life and hope to come out the other side with our relationship intact. My mom opens the drawer in my nightstand and gazes down at the large collection of prescription pill bottles, which she spent 20 minutes labeling yesterday afternoon. Each bottle now wears a name tag across its cap, a piece of blue painter's tape with my mom's neat kindergarten teacher handwriting in red ink. This way, it's easier to see what each bottle holds without having to lift out the container and search the label for the medication name. Mom reaches to the top of the table and picks up the spreadsheet that she and Mark created 2 days ago so they can keep track of what pills I've taken. "It's been 8 hours since your last dose of Ativan," she says. "That's for anxiety. Do you want one now?" "Yes," I sniff. "Can I take an Ambien, too?" "I took one 2 hours ago, but it didn't do its job of putting me to sleep." "Did you take one earlier?" she asks. "No," I lie. "I'm thinking that if I double up, maybe it will knock me out for a couple of hours. My body aches for sleep after being awake for nearly 3 days." My mom hands over 2 little white pills. I slip them under my tongue and let them dissolve so the medicine will absorb more quickly into my bloodstream, a trick I learned years ago when I struggled with a serious addiction to prescription pills. The medicine creates a bitter, chalky paste in my mouth and a sinking burn in my belly. Having to take all these pills has reignited my addiction after 5 years of sobriety. I sip water from the small green plastic cup that never leaves my bedside.